Welcome to Clinical Concepts with Dr. Atifa. In this video, we will learn how to interpret a CT chest and HRCT step by step using a simple systematic approach. Before looking for disease, always confirm the basics. Check the patient's name, age, and scan date. Identify whether it is a routine CT chest or a high-resolution CT, also called HRCT. Note whether contrast was used and whether the scan was performed during inspiration or expiration. Understanding image orientation is essential. The top of the image represents the front of the patient, while the bottom represents the back. Remember that the left side of the image corresponds to the patient's right side and the right side corresponds to the patient's left. Always review the scan using two windows. The lung window is used to assess the lung tissue, airways, nodules, and consolidation. The mediastinal window helps evaluate the heart, great vessels, mediastinal lymph nodes, pleura, and other soft tissues. To avoid missing important findings, use the ABCDEF approach. A stands for airways, B for breathing or lung parenchyma, C for circulation, D for diaphragm and pleura, E for everything else, and F for bones. Following the same sequence every time makes reporting more accurate. Start by examining the airways. Check whether the trachea is central and whether the bronchi are open. Look for bronchiectasis, bronchial wall thickening, or mucus plugging. These findings can suggest chronic infection, inflammation, or airway disease. Next, evaluate the lungs themselves. Look for consolidation, ground glass opacity, nodules, masses, cavities, fibrosis, emphysema, honeycombing, or mosaic attenuation. Always compare both lungs from top to bottom. Now, assess the cardiovascular structures. Check the heart size, the aorta, the pulmonary arteries, and look for any pericardial effusion. Enlargement of the pulmonary artery may suggest pulmonary hypertension. Inspect the pleural spaces for pleural effusion, pneumothorax, or pleural thickening. Also examine the diaphragm for elevation or abnormal contour, as these may indicate underlying pathology. Never forget the surrounding structures. Examine the mediastinal lymph nodes, chest wall, visible thyroid glands, esophagus, and the upper abdominal organs included on the scan, such as the liver, spleen, and adrenal glands. Finally, review the bones. Look carefully at the ribs, vertebrae, sternum, and clavicles for the fractures, lytic lesions, or other abnormalities. Many important bone findings are detected incidentally on CT chest. The final step is pattern recognition. Ground glass opacity appears as hazy increased lung density while vessels remain visible. Consolidation is denser and obscures the vessels. Honeycombing appears as clustered cystic air spaces and usually indicates advanced pulmonary fibrosis. Bronchiectasis is identified by permanently dilated bronchi that appear larger than their accompanying pulmonary artery. Thank you for watching. If you found this video helpful, please like, share, and subscribe to Clinical Concepts with Dr. Atifa for more easy to understand medical lectures and clinical examination tutorials.